So my name is Spencer Green. I'm the current president of the California Orthotic and Prosthetic Association, and just like to thank everyone for hopping on this call. As many of you know, we've had a lot of activity in the area of legislation as we are pursuing fee schedule reform and trying to improve the landscape of O&P in California. An integral part of this process has been Bryce Docherty, who's joining us today to share. Bryce is the founder and CEO of TDG Strategies. For over 25 years, he has represented a vast array of healthcare and medical interests before all areas of state government, including physicians, surgeons, pharmacists, mid-level healthcare providers, medical device manufacturers, so on and so forth. He has been responsible for driving the direction, the integrity, and the strategic success of efforts such as restoring the benefit coverage for Medi-Cal by the Medi-Cal program, as well as improving the fee schedule for California P&O providers. Bryce lives in Sacramento and with his wife, Natalie, and his daughter, Eleanor, and I'm very pleased to hand over the microphone to him. So thank you, Bryce. The floor is yours.
Well, thank you, Spencer, and thank everybody for joining us today at the lunch hour. If you are having lunch, enjoy. I appreciate that introduction, Spencer. Sometimes when I hear that, I anticipate my dad showing up, but I have been doing this for 26 years now, and I've been proudly representing COPA for 17 of those 26 years. So it's been a wild ride, and we've had a lot of success. And today I'm going to touch on a little bit of the political landscape that we're dealing with, a little bit of a historical perspective on some of our legislative activities, which has set us up nicely for the work that we're doing on our Medi-Cal fee increase initiative. So let's just get started. So I want to inform everybody that we are going through what has been commonly referred to as the Great Resignation in Sacramento. As some of you probably know, our California state legislature is made up of 120 members. We have 80 members in the state assembly, and we have 40 members in the state Senate. Now, a Senate district typically encompasses about 1 million Californians, and then the assembly districts encompass about 500,000 Californians. They try and what we call nest the two assembly districts in close proximity to that Senate district, although they don't necessarily always kind of overlap exactly. We're also have gone through the once every decade process of redistricting, which is redrawing all the lines, the congressional lines, the Assembly and Senate state lines, as well as the County Board of Supervisors district lines. As a result of that process, some legislators were drawn out of their current districts, and some legislators were drawn into districts, and we were finding that two incumbents were facing off against each other in a new district. I think that coupled with the COVID pandemic over the last 2 years, it has made it very, very difficult to legislate. We've been trying to legislate virtually by way of phone line systems for hearings. The Capitol has been closed to the public. Some of those restrictions are starting to ease. Plus, the legislature has moved over to what we call a swing space. It's a temporary office building space where the legislative offices and hearing rooms have been moved while they do some demolition to the state capitol. There's a portion of the state capitol called the annex, which is where a lot of the legislative offices and committee hearings are, that is woefully outdated. And the legislature is in the process of demolishing that part of the capitol and rebuilding. So a lot of logistics, but we are getting back to in-person, somewhat of a hybrid in-person versus virtual, but it has been frustrating. So in terms of the Great Resignation, there's 25 current members of the state assembly who have either already resigned, will be running for a different office, or who have elected not to run for re-election in 2022. That, coupled with the turnover and term limits, is going to put us at about a 20% turnover in terms of brand new legislators in the state legislature this year. that coupled with those members that are termed out. So we're looking at about a 20% turnover in the state legislature this year, and then another 38% in 2024 during that election cycle. So by 2024, over half of the state legislature will look brand new. Of the 4 members of the assembly who have already resigned, includes Jim Frazier, David Chu, Assemblymember David Chu from San Francisco, who got appointed to be the San Francisco city attorney, resigned in November. Assemblymember Autumn Burke has resigned, and Assemblymember Lorena Gonzalez from San Diego. Assemblymember Lorena Gonzalez from San Diego, for example, was chair of the Assembly Appropriations Committee, which is a very powerful committee in the state legislature that analyzes bills based on the fiscal impact, the downward pressure on the state budget. We'll talk a little bit later about why that committee is so important, but Lorena Gonzalez, for example, really got a once-in-a-generation job opportunity, and she now heads up the California Labor Federation. The outgoing head of the Labor Federation retired this year, and Lorena Gonzalez was a former labor organizer down in San Diego and Imperial counties. The special election to replace her will be June 7th. The special election to replace Assemblymember Autumn Burke will be June 7th. We just had an election on April 19th, and we elected Matt Haney to replace David Chu. And Lori Wilson on April 5th was elected in a special election to replace Jim Frazier. So we still have 2 vacant seats in the assembly, but we will know the disposition of those races on June 7th. Here is a list of the 10 legislators who are running for a different office. And by virtue of running for these offices, they are not able to run for their current seats. As you can tell, most of these are members of the Assembly, 1 member of the Senate. I'll start with Senator Kamlager down in Los Angeles. This was an interesting ride for her. She was a member of the Assembly, got elected to the Senate in a special election because that state senator, Holly Mitchell, got elected to the Los Angeles County Board of Supervisors. So Kamlager got elected to the state Senate. We've also learned that Congresswoman Karen Bass, who was a former Speaker of the California Assembly, has elected not to run for re-election to Congress. She was chair of the Legislative Black Caucus. She's decided to run for mayor of Los Angeles. So that opens up a spot in Congress for Senator Kamlager to run for Congress, which will require her to surrender her Senate seat. That's just one example of the multitude of musical chairs that are taking place with regards to the 10 legislators that are listed here. Kevin Kiley is another name that kind of jumps off the page here. Some of you may recall, he's an assembly member who ran against Gavin Newsom for the recall last year and lost. Now he's running for a newly created congressional district encompasses primarily Placer County in Northern California. The other thing that I will note there is we have Assembly Member Adam Gray, Democrat from Merced. He's running for Congress. We'll talk a little bit more about Adam Gray, why he is important to us. But what we find, and this is either a gift or a curse that we give to AOPA, but what we find is if you look at the California delegation to Congress, which is now shrunk by 1 seat from 54 members of Congress to 53, we find that 1/3 and growing of our congressional delegation in DC are former members of the California state legislature. And it's always bad when we see good members leave us, like Assembly Member Adam Gray. That is what we consider our gift to AOPA, but it isn't that bad of a situation when we've got a difficult legislator that is either termed out or moves on. And then lastly, we had a number of state legislators who have elected not to seek re-election this year. There's 11 of those listed here. Again, for a variety of reasons. Some are retiring, some are going back into private practice to probably make more money and not have the hassle factor of trying to legislate in somewhat of a difficult environment. And what's interesting in some of these races, for example, Assembly Member Chad Mays jumps off the page as well. NPP after his name means that his party affiliation is no party preference. So in California, our legislature is made up of either Republicans or Democrats. But as you know, you can elect and register as a California voter to be a Republican, a Democrat, a Libertarian, a Green Party, no party preference, which means you're not stating a political affiliation, a whole host of things that you can self-identify as. Chad Mays is a former Assembly Republican leader, and was somewhat ostracized by his party, given the fact that he was more moderate in nature and had a really good ability of working with some of the Democrats. And so what he would argue is he changed his affiliation from Republican to no party preference. And what he will tell you is that he didn't leave the party left him. So he's the only state legislator in about 20 years that is technically an independent. And he was vice chair of the Assembly Health Committee. So he's elected not to run. And so what you have here is you have a lot of members who waited until the actual last day of the filing deadline to file their intent to run for office, and elected not to file the paperwork. And in many of these instances, it's either the legislator's district director or their chief of staff who filed the paperwork to run for that seat. So by default, I think a lot of these legislators were attempting to pass on their legacy and keep political consistency in their districts. But 11 members outside of those who are running for other office and or those who have already resigned is a big deal for us. And it really points to the fact that whatever we're doing on the advocacy side, whether it's budget, whether it's policy, whether it is elections, this is not a one-time thing. This is an ongoing thing that COPA has been involved in, that we need to be strategically thinking about. We're going to talk a little bit later about our Medi-Cal campaign and some of the tours and visits that we did in some of our facilities. Those are really very, very special moments for us to kind of tell our story and talk about what it is that we do. And so we'll talk a little bit more about that. But we are going to see a changeover by 2024 of nearly 60%, of the state legislature. So I just wanted to kind of provide that context to you, because if anything is consistent in Sacramento, it's change is consistent. And so, many of the policy issues that we deal with are always shrouded in politics. And we must remember the Latin derivative of the term politics, which is poly being many and ticks meaning blood-sucking insects. So that joke usually plays better in person. But anyways, let's move on to who are the decision makers for orthotics and prosthetics, and particularly O&P providers in California. It's basically the state legislature. There is no regulatory board or bureau or commission within state government that regulates orthotic and prosthetic providers. However, what you do see here is language that speaks to, in the Welfare and Institutions Code, which is the enabling statute that guides basically our Medi-Cal policy work, that in the Welfare and Institutions Code, in addition to being a podiatrist and or a physician, it requires that an orthotist prosthetist providing services under this chapter, which is essentially the Medi-Cal program, shall be certified by ABC or BOC, and this section shall remain in effect until the director executes a declaration or adopts rules and regulations guiding a different method and pathway for requirements for O&P providers to participate in the Medi-Cal program. That has not happened. That will never happen. So essentially, the only requirement in state law to function as an orthotist prosthetist is when it comes to Medi-Cal, and when it comes to Medi-Cal, those O&P providers must be certified. Okay, a little bit of history lesson 101 here. In 2006, COPA sponsored AB 2012, which was passed and signed into law, and it clarified the existing requirement that health plans and insurers have in terms of offering coverage for orthotic and prosthetic devices and services. In California, we have a whole host of mandated coverage benefits, which it's a requirement that health plans and insurers cover a particular service. when it comes to orthotics and prosthetics, we don't have a mandate to cover. We have a mandate to offer coverage for orthotics and prosthetics. And what we had found prior to 2006 and prior to introducing AB 2012 was that there was orthotic and prosthetic coverage that was being offered, but it was bogus coverage. And for example, many of the health plans and insurers lumped the orthotic and prosthetic benefit into the DME benefit. Blue Cross at the time in particular, and Anthem, had annual caps on that category of benefits as low as $2,000 a year for the entire category. And there were no things related to office visit copay, and the O&P benefit was not treated, if it was being offered, was not being offered and treated as any other mandatory healthcare benefit. So what COPA did is we sponsored AB 2012 and basically said the mandated offer to provide coverage for orthotics and prosthetics must be real coverage, must meet all of the conditions of any other mandatory covered benefit, including out-of-pocket costs, including office visit copay, including caps. And it also forced health plans and insurers to break out orthotic and prosthetic coverage from the DME benefit. And all of you know better than I why that could be a problem. So if you've got a 2,000 annual cap for DME and orthotics and prosthetics, and you need crutches or a wheelchair, what have you, and then if it came time to needing benefits or coverage for an orthotic and prosthetic device, that benefit was no longer available. The most interesting piece about this legislation was that this legislation was passed when we had Governor Arnold Schwarzenegger, and most mandated coverage or mandated offering bills end up either dying in the legislature or getting vetoed because of the added cost to the system. This was the only mandated offered coverage legislation that Governor Schwarzenegger signed when he was governor. And a lot of this has to do with timing, but also due to our advocacy efforts, we found that the director of the Department of Managed Healthcare, who was to oversee a lot of this work, herself was an amputee, and she helped usher in the parity law for orthotics and prosthetics in the state of Colorado. So as we do a lot of this advocacy work and as we continue to engage on these issues, what happens sometimes is what I call stepping into a sugar bowl. And we stepped into a big sugar bowl in 2006 with the director of the Department of Managed Healthcare. I put up this quote, which was the signing message that the governor gave on AB 2012, just because they typically don't do signing messages. If they veto a bill, if a governor vetoes a bill, the governor will do a veto message, but rarely do they do a signing message. So we particularly like this quote from the governor because the governor's office at the time asked for it, and so we wrote it. But it's also just a very nice way of memorializing the work that we did on that bill and why that was important. So let's pivot a little bit to Medi-Cal and orthotic and prosthetic reimbursements in the Medi-Cal program. COPA has had a long history of work with regards to Medi-Cal. The only thing that is prescribed in state law with regards to the method and manner by which orthotic and prosthetic devices are reimbursed in the Medi-Cal program is captured here, Welfare and Institutions Code 14105.21D. And it states that reimbursement for prosthetic and orthotic appliances as defined may not exceed 80% of the lowest maximum allowance for California established by the federal Medicare program for that same or similar service. We'll talk a little bit later about that language in particular, but this language really pertains now to a Medi-Cal fee-for-service sort of environment. And those of you that take Medi-Cal know that we are almost exclusively in a Medi-Cal managed care sort of environment. And what that means is the Department of Healthcare Services that is charged with administering the California Medi-Cal program sends almost, if you will, block grant funds to health plans, or to, in the instance of Orange County, there's Cataloptima. There's one entity that's providing all the Medi-Cal managed care services. The department comes up with a PMPM that is intended to cover all of the required services that the health plans or the county health agency is required to cover and provide services for in the Medi-Cal program. That trickles down into more times than not, a negotiated rate on behalf of the Medi-Cal providers. The important piece of establishing a very specific methodology for reimbursement for Medi-Cal in the Welfare and Institutions Code is because that becomes the baseline for a lot of those discussions. This language, and we'll talk a little bit more about it, this language, by saying it shall not exceed 80% of the Medicare allowable, that doesn't mean that we're getting reimbursed at 80% of the Medicare allowable. We'll talk a little bit about some of the discretion that the department has, but our analysis shows that some codes are paid at 80%. Some are even paid a little bit above 80% of the Medicare allowable, but also many codes are reimbursed at rates that are woefully too low, 15, 20% of the Medicare allowable. And we'll talk a little bit about the efforts we've been doing and the specific legislation and budget requests that we've been doing in order to kind of clarify that methodology. But this slide also just kind of bullet points out for everybody kind of our history on the Medi-Cal issue. So just briefly, in 2007, this was during the Great Recession. We were still under a Schwarzenegger regime. In 2007, we were facing a $20 billion budget deficit. And some of you may recall, there was a proposal by the governor to eliminate all optional Medi-Cal benefits in the California Medi-Cal program. California is a state that has the most robust optional benefit categories than any other state. There are about 55 optional benefit categories, including orthotics is one category, prosthetics is another category, dental, chiropractic, acupuncture, optometry, a whole list of things. And we were part of the 55 optional benefits that were slated to be completely eliminated in 2007. We mobilized. We were part of a large coalition of additional providers. We partnered with the Amputee Coalition of America. We were able to convince, and we were actually the first optional Medi-Cal benefit that was restored by the legislature from those cuts in 2007. So that was really kind of our first foray into the Medi-Cal issue. And we understand as an association, some of our members take a lot of Medi-Cal, some take a little bit, some don't take any, but eliminating this optional benefit category would have been terrible for the industry. So we were at least kind of clawed back to zero, which takes us to 2009. So in 2009, it was then Governor Jerry Brown who instituted a 10% across the board Medi-Cal fee reduction for all Medi-Cal providers as we were kind of climbing our way out of the Great Recession. There was a lawsuit that was filed by the California Medical Association, the California Dental Association, staying that order. And there was a 6-month period by which the Department of Healthcare Services did not institute the 10% provider rate cut while the lawsuit was adjudicated. It turned out at the end of the day that the governor and DHCS could in fact institute a 10% provider rate cut. So many of you saw a 10% provider rate cut in Medi-Cal that took effect in 2009, and that is still in place today. However, that's in the process of being fixed, and we're going to talk about that in a second. Some of you also were experiencing what we call a clawback. So a lot of our members at the time were getting future check rights for Medi-Cal were being diminished based on a percentage of fees that they should have been taking as a reduction in that 6-month period during when the lawsuit was being adjudicated. So we didn't know what those numbers were for the providers. We didn't know if there was a way to, claw that back outside of future check rights they were getting from Medi-Cal. So we actually worked with the Medi-Cal program and actually got down to the level of working with cash control, which was administered by Xerox at the time, and tried to bounce out of the clawback program to try and ascertain how much providers are owed the Medi-Cal program, and was there a way to work around that. It was relatively quiet, I would say, on the Medi-Cal front up until about 2019, 2020 during COVID, where we embarked on our Medi-Cal fee increase initiative. We also learned from some of our members down in Orange County in 2020 that CalOptima, which is the sole provider of Medi-Cal benefits down in Orange County, was reimbursing orthotic and prosthetic providers below the actual Medi-Cal rate that we talked about a couple slides ago. We petitioned CalOptima. We asked CalOptima to revisit their health plan benefit design for orthotics and prosthetics. They did revisit that. They actually changed their policy and were at least agreeing to pay at the Medi-Cal rate. So where we find instances where we're at least not getting 100% of the Medi-Cal fee schedule, COPA has engaged and advocated on behalf of our members down in Orange County. Which takes us to our present, COPA-sponsored Medi-Cal O&P fee increase initiative, which we'll talk quite a bit about today. As part of that, in 2021 and this year, COPA has sponsored a budget request. This is a stakeholder request that was sponsored by Assembly Member Vince Fong for us, who is from the Bakersfield area, who we've got close ties to him in the district. And our budget request does one of two things. One is it asks for a restoration of the 10% Medi-Cal fee restoration from 2009. And it is a budget request to complement our legislative effort that we have underway this year by way of COPA-sponsored AB 1892 by Assemblymember Heath Flora. And we're going to talk quite a bit about both of those issues more in depth. The other thing I wanted to make everybody aware of with regards to some of the budget highlights this year, the governor has realized that the AB 97, the cuts from 2011, the additional 10% provider rate cuts, have been in effect for 11 years. And we are facing a budget surplus in the neighborhood of $50 to $60 billion with a B. So if there's ever a time for us to get a bump in our Medi-Cal rates, I would argue that this is the time. The governor did come out in his proposed state budget in January of this year, proposing a restoration of the Medi-Cal 10% provider rate cut for only 8 classes of providers. Like we talked about, there's 55 different optional benefits that were subject to the cut. And his proposal is just to restore 8 of the 55. Those that he picked were nurses of all types, alternative birthing centers, audiologists, hearing aid dispensers, respiratory care providers, select DME equipment providers, chronic dialysis, non-emergency medical transportation providers, and emergency medical air transportation providers. The administration couldn't necessarily answer why they picked those providers over other providers. They did mention that it was based on COVID-19 impact. I would argue with that. And so the proposal to just restore the 10% provider rate cut for those 8 classes of Medi-Cal providers is about $20.2 million, which would be a $9 million general fund obligation and $10 million general fund obligation ongoing. So our budget proposal asked for orthotics and prosthetic devices to be added into the governor's proposal to restore that 10% provider rate cut. We have a lot of momentum. We'll talk a little bit about some of the players in this space and some of the tours that we've done, which has kind of elucidated for them the value that orthotics and prosthetics provide to Medi-Cal patients, and that, quite frankly, the cost savings that we save other parts of the Medi-Cal system by virtue of having increased access to orthotic and prosthetic devices. I will tell you that there is a movement, and the Assembly has made it a budget priority to restore in this budget all of the 10% provider rate cuts for all affected Medi-Cal providers. This is probably a smarter policy, but it's also a $200 million state fund obligation. But I think it sends a message to providers that says when times are tough, we're going to have to make tough decisions. But when we're flush with cash, we're going to undo, the tough decisions that we made. So I know it's not something that folks are going to be able to send their kids to college on, but I think at least it gets us back to zero. And if we can get the 10% restored, it's a great building block with this administration to talk about access to care, to talk about providing equitable care to California's most vulnerable population, including 50% of our children that receive their medical care through the Medi-Cal program. So if we're able to restore the 10% on top of our effort to try and get our rates up to at least 80% of the Medicare allowable, that would be a huge success. What folks should know is the state budget process is a process that runs parallel to the state legislative process. So legislative bills, AB, SBs, move through the regular legislative process, which means they go through policy committees, they go through the appropriations committees. The budget process is a process that is worked up through the two budget committees. Now, it's a lot of X's and O's and dollars and cents in the budget process, but this governor in particular likes to do a lot of policy work through the budget process as well. So we have a dual track process this year. One is through the budget process, one is through the legislative process. I'm indifferent on which process gets us to the promised land quicker. Whichever does, we'll abandon the other approach, but we're basically, doubling down both on the budget play and on a legislative play. I will tell you that we are nearing, we're in the position of precarious balance right now. The governor on Friday of this week, tomorrow, will be coming out with what he calls his May revise, and that is a revision to the proposed budget he made in January. And that May revision is largely due to changes in the tax revenue. We're well ahead. We've got our budget surplus will be increasing. So the governor may make some significant changes to what he proposed in January. And I'll be watching this line item very closely tomorrow to see if the May revise that he comes out with actually includes orthotic and prosthetic providers as part of that 10% Medi-Cal rate restoration. So let's talk a little bit about our Medi-Cal O&P fee increase initiative and the campaign itself. This is an effort that COPA has undergone and we've been working on for about 4 years. And we are really hitting our stride this year. What this slide represents is we, under the guidance of CASA, or the COPA Board of Directors and our Government Affairs Committee chaired by Rick Riley, we were very assertive last year in our outreach to the state legislature. We were able to perform 7 grassroots facility tours in local legislators' districts. For example, what you see here on the left-hand side is Senator Susan Eggman. She toured one of Spencer's hangar facilities down in Stockton last fall. Why is Senator Eggman important? Senator Eggman is important because she is chair of the Senate Budget Subcommittee on Health and Human Services. So our state budget committee is broken up into 4 or 5 different subcommittees. One is criminal justice, one is education, one is state administration, one is health and human services. So this subcommittee works up everything related to the Department of Healthcare Services, Medi-Cal, Department of Public Health, HCI, you name it. And so we felt it was important before we came out with our bill and before we came out with our stakeholder budget ask again this year to get her into a facility. And it's a fantastic facility there in her district. It's somewhat of a medical campus that she helped bring to her district and revitalize. And we got to spend, about an hour or 2 with her We took her through the facility. This was a patient that she met there. Patient talked about his experience, the fact that he was a truck driver and he got into an accident and is a below knee amputee. And had it not been for the Medi-Cal program and for Hanger and the orthotic and prosthetic, the prosthetic that he wears, he wouldn't be able to get back to driving his truck in gainful and independent employment. She was taken back by that example. We were also able to take her back into the manufacturing area of the clinic, where she saw the time and energy it takes to manufacture and fabricate and fit one of these devices, not simply providing an appliance with no follow-up. The middle picture here is a tour that Riley Liddell did down in Turlock, I believe, for Assembly Member Philip Houdwa, a Democrat from the Stockton area. And then the right-hand side, on the far right, that's Assembly Member Adam Gray, a Democrat from Merced, who's running for Congress. So these tours are really mission critical. It really helps punctuate for them the things that we do. You get reimbursed in Medi-Cal per device. You don't get reimbursed for the service component, which is the manufacturing, the fabrication, the fitting, the ongoing adjustments. So all of those costs are baked into the cost of the appliance. And that's kind of what we're able to convey during some of these tours. This is what led us to introduce AB 1892. Many of you should be seeing a lot of information that COPA is pushing out on this bill. On the right-hand side here are all the players that are involved in this legislation. It's authored by Assemblymember Heath Flora, who's the gentleman in the upper left. He's a Republican from the Ripon area down the Central Valley. He's also vice chair of the Assembly Business Professions Committee, and he's the Republican floor leader. To his right, the rest of these members are co-authors of our bill. To his right is Assembly Member Vince Fong from the Bakersfield area, Republican, who is also sponsoring our budget request. The bottom left is Assembly Member Philip Houdwa, who on the prior slide toured an OMP facility, PacMed facility in Turlock. And then obviously Assembly Member Adam Gray on the bottom right there. It's not by accident that Assembly Member Flora is authoring this bill, and 3 members of the state legislature whom we toured last fall have agreed to co-author the bill. So this was part of our campaign and our ramp up of getting this legislation introduced. Basically, what this legislation does is it changes the current methodology in the Welfare and Institutions Code on how orthotic and prosthetic devices are reimbursed, and it eliminates the shall not exceed 80% of the Medicare allowable requirement, but says shall at least be 80%. So the ceiling, quite frankly, that we have under existing law, that it shall not exceed 80% of Medicare, would become the floor under our legislation. So the minimum amount that orthotic and prosthetic devices would be reimbursed in the Medi-Cal program would be 80%, but it could exceed 80%. These are just a couple slides of, I'm not going to read them, but this is how we're kind of talking about and arguing the need for the fee increase. We can't go to legislature and say, woe is me, I'm a business owner and my margins are diminishing and I'm making less money and I need more money to keep my business afloat. We talk about this as it pertains to the access to care crisis that we believe we're experiencing for Medi-Cal patients in the California Medi-Cal program. It's all about the patient experience, but it's also a function of explaining to them how orthotic and prosthetic appliances are actually provided to patients. This category has not been increased in over 25 years when it was established. The legislature needs to understand that when you provide somebody an orthotic and prosthetic appliance or device, there is not only the cost of materials, but there's the labor, there's the equipment, there's the utilities needed to fabricate and dispense the products, to make sure it fits properly and to adjust. And those are all sunk costs, in addition to the fact that you have to make sure that the components that you're getting and the device that you're getting is something that doesn't exceed the cost for you to provide the device. According to the California Healthcare Foundation, Medi-Cal includes 40 to 50% of all children. Half of those people have disabilities, over 1 million seniors, nearly 4 million adults. receive their care through the Medi-Cal program. And so what we have been doing in California is we've been expanding our Medi-Cal program to cover more individuals. Most recently, we included Medi-Cal coverage for undocumented immigrants 50 years of age and above. And this budget proposal this year seeks to close that donut hole and allow Medi-Cal coverage for any and all Californians, regardless of immigration status. But as we know, in some of the arguments we've been making, coverage does not actually equate to, and oftentimes doesn't equate to, increased access to that care. On average, our data, we collected 10 years worth of orthotic and prosthetic claims data from the Department of Healthcare Services that we spent about 18 months combing through and repurposing. And what we found is, even though the California Medi-Cal rate shall not exceed 80% of the Medicare allowable, we found on average, we're being reimbursed about 51% of the Medicare allowable rate. We compared that rate to rates nationally for other states and their Medicaid reimbursement rates. And on average, across the country, the Medicaid reimbursement is about 75%. So if we can get up to 80%, we will be, I know it's not 100%, but you'd eat an elephant one bite at a time. And if we got to 80%, we would be at least north of the national average. And then we also continue to make arguments about why orthotic and prosthetic devices are important, right? And these are socially vulnerable, patients, many of whom are amputees, many of whom are suffering from diabetes and other comorbidities. And I just don't think the legislature fully understands the impact that having a prosthetic device in particular, the impact that has on a patient's ability to be successful, to participate in school, to lead an independent life, to work, and to be giving back to their communities and their families. Okay, how much is it going to cost? It's going to cost a lot of money to go from the average rate we're being reimbursed now to at least 80% of the Medicare allowable. The total cost for the increase that we've been able to handicap is about $27 million. To get to that number, about half of that would be covered by the California General Fund. We break that down over a 3-year spend to try and make it somewhat of a smaller bite, which would be about $4.5 million over a 3-year period. The remaining funds would be federal matching dollars. It is the legislation that we currently have, AB 1892. It passed out of the Assembly Health Committee with bipartisan, unanimous support. It is a bipartisan bill. We do have Republicans and a Democrat in Assemblymember Villapudua on the bill. So the bill flew out of the Policy Committee. The bill was heard last week in the Assembly Appropriations Committee, but due to the increased general fund obligation and the big downward pressure on the state budget, the bill has been placed on what is called the appropriations suspense calendar. And that is a place where a second layer of analysis is done. That analysis is being done right now as we speak. We continue to work with the Assembly Appropriations Committee to try and score some cost savings that would potentially offset some of the costs to increase the rates. We won't know if the bill gets off the suspense calendar until the Assembly Appropriations has that hearing, which is currently slated for, I think, May 18th, Thursday, May 18th. If the bill gets out of appropriations, it goes to the Assembly floor. If it gets off the Assembly floor, it goes over to the Senate, and it goes through the same process in the Senate. So it has to go to the Senate Health Committee, the Senate Appropriations Committee, and the Senate floor. All said and done, our legislative session ends on August 31st. So if the bill continues to move, it won't be passed by the legislature and on the governor's desk until the end of August. The governor has 30 days by which to either sign or veto any legislation that is sent to him at the end of August. If he does sign the legislation would not take effect until January 1 of 2023. So that's pretty much the timeline on the legislation. The last piece of data I wanted to kind of share with you, these were some charts that we repurposed from the 10 years of Medi-Cal data that we got from the Department of Healthcare Services. And this is claims data from 2008 to 2017. What's really startling about these charts, and this is original COPA work product, and this is just for Sacramento County. I want to illustrate for you these two lines. So the blue lines on these charts represent the statewide average, and the red lines represent Sacramento County. The claims data that we obtained from the Department of Healthcare Services, we have claims data for every single county in California. So we repurpose this information for all 58 counties. I just picked Sacramento because the capital's there, and why not? So if you look at these charts, this illustrates what we're feeling in the field in terms of diminishing reimbursement and a potential and a current access to care crisis. For example, if you look at the claims chart, you look at the total number of orthotic and prosthetic claims over the 10-year period, you see an exponential increase in Sacramento County alone, from one tick under 4,000 claims in 2008, and it explodes to, let's call it 11,000 claims in 2017. Most of these increases are happening around the 2012, 13, 14 range, where we started expanding Medi-Cal eligibility. The chart below that is the number of unique beneficiaries. So these are the Medi-Cal providers that have been receiving orthotic and prosthetic benefits from 2008 to 2017. Same sort of trend, right? Sacramento County, you had, let's call it 2,200 unique Medi-Cal beneficiaries receiving orthotic and prosthetic care in 2008, and again exploding almost 3-4-fold to about 9,000 patients in 2017. We have to juxtapose that with the billing provider chart, and I would say 99% of the billing providers for orthotic and prosthetics in California for Medi-Cal are certified orthotists, prosthetists. Those numbers aren't increasing at a commensurate rate with the number of claims and number of beneficiaries. So over that same period of time, we see the number of billing providers go from 200 to maybe 350. That is a de minimis increase compared to the exponential increase in the number of claims and the number of unique beneficiaries. This is very, very valuable data for us, and this was a multi-year project to repurpose the state's data to actually illustrate our point. And so this data, coupled with the arguments and coupled with the work that we're doing in the budget process, we're guardedly optimistic that we will get some relief in the Medi-Cal program this year. And this was not something that just happens on its own. This is based on the leadership from the board and a lot of input from you and the COPA members. When the bill was heard, when our legislation was heard in the Assembly Health Committee the first week of April, we had almost 40 OMP facilities submit letters of support. So the committee analysis looked great. It looked like there was, broad-based, wide support all across the state for increasing Medi-Cal rates. So I just want to deplore you to watch for additional updates when we ask you to send letters or contact or reach out to your legislators, or if you're seeing information in the COPA Connection newsletter, please heed that advice, because we can't do it alone. We also need your street heat. So with that, I'm going to pause. I am going to make a PAC pitch. Your COPA dues dollars go directly to fund my efforts as your association lobbyist, but dues dollars can't be used to support our political action committee. As you can tell, we have a lot of action in the state legislature. We've procured a lot of champions who are championing our issue, and we need to continue to support those legislators that understand our industry, who come into our facilities and who are willing to put their neck on the line and champion our issues. So this is my obligatory PAC pitch. There's a link here. You go on the COPA website and make a contribution. I just like to quote here Assembly Member Speaker Jess Unruh from the mid-60s, the first kind of modern day powerful Assembly Speaker, who said, "Money is the mother's milk of politics." And I would also argue that it's not about the money, it's about the money. So anyways, I'm going to conclude my comments there. I'm happy to entertain any questions. Thank you.
Thanks, Bryce. So I think that as all of the attendees can see, Bryce is just a critical partner to COPA in legislative events. He has been masterful in helping us to navigate Sacramento, put us in front of the right people, and allow us the opportunities to have meaningful conversations with these legislators. So I want to open it up to the group here. Are there any questions for Bryce? And while you're thinking about your question, I'll throw one out there. So Bryce, what do you see as the biggest hurdle moving forward for getting the fee schedule reform passed?
Yeah, I think it's a function of the spend. We were able to quantify from a policy perspective the benefits of orthotics and prosthetics in a number of peer-reviewed journals, and the propensity for diabetic patients needing amputations and what have you. We need to do a better job, and if anybody has an idea, we need to do a better job of trying to offset and or quantify an increase in reimbursement rates, which we can argue will increase access, but that the increased access will decrease more expensive care in other parts of the Medi-Cal program. And we can talk about that anecdotally. We know, for example, that if somebody's not able, a Medi-Cal patient's not able to get into one of our clinics for a prosthetic device, particularly if they're a below knee amputee, you know, they're going to be on crutches, they're going to be in a wheelchair, they may get a inferior sort of device, they may end up in a more critical situation, they might receive that care through their physician's office, they might end up in an inpatient environment with different ailments that cost the system exponentially more than, you know, what we would argue is a de minimis amount in the increase in the fees. So I think the bipartisan unanimous vote of the Assembly Health Committee on the policy speaks to the fact that they get what we're doing. It just comes down to a dollars and cents transaction.
Any other questions from the group? Bryce, you mentioned donating to the Political Action Committee. What else can COPA members do to help?
I think what we have found, we pressure tested our site visit legislative facility tour program. We pressure tested that with our board of directors, and it was hugely successful. So I think one of the things that COPA is going to consider going forward, and what I would ask folks on this call to talk about and to be available to help, is when you do get those alerts from us on either sending a letter or reaching out to your local legislator. We have been partnering with AOPA to use their grassroots software, which simply matches you with your local legislator, and we have a pre-cooked statement asking for their support on a bill, so we can do that. But if there are additional COPA members, and I think we're going to expand the grassroots program to any and all COPA members, if you're interested in touring a legislator in your facility, you know, please reach out to Spencer or the COPA office, and we can look to schedule a tour in your district.
Yeah, I have personally been pleasantly surprised by the how easy it is to tour a legislator. They don't know. They just don't know what we do inside of a clinic and what a lab looks like where the fabrication occurs, and they're blown away. They're also very interested in what their constituents are doing. So I really encourage you, if you're interested in forming a relationship with your legislator, reach out. Let us help you with it. Don't go this alone. We have relationships. Specifically, Bryce can kind of make sure it's all aligned, and we'll do it with you.
Yeah, we have talking points, internal talking points that we've crafted, and yeah, it's a really great opportunity. So I think they're going to blow the doors off that program the remainder of this year into next.
Bryce, what's the next step in the legislative process? I mean, you've got the May revise, which will come out tomorrow, looking at that. And then how about our legislation? Where does it go next? And is there anything we can do on that process?
Yeah, so the May revise will come out tomorrow. Then the real work on the budget starts. So the two budget committees, the Assembly Budget and the Senate Budget Committee, work through all the provisions of the governor's budget, and they either agree or disagree. Then the issues that they don't agree on go to a budget conference committee, where they iron out some of the details. So we're trying to get our fix either in the budget or at least make sure we're part of the 10% provider rate restoration. And that work will happen between May 15th and June 15th. The budget has to be signed, the big budget has to be signed by the governor constitutionally by June 17th. The legislative process, like I said, goes a little bit longer. So if we get off the suspense calendar, we get out, our bill gets out of the Assembly Appropriations Committee May 19th, then it heads to the Assembly floor. And it has until the end of May to get off the Assembly floor. And then if it was to get off the Assembly floor, it heads over to the Senate, where it'll be heard in the Policy Committee in the Senate, which is in this instance, the Senate Health Committee. And those hearings take place the month of June. By the end of June, it should be out of the Senate Appropriations Committee. From July 1st to August 1st, the legislature recesses for their summer recess. So there's no activity for 30 days. They come back on August 1st, and then it's basically a 30-day mad dash to the end of session. So that's kind of the timeline, but everything kind of hinges on next Thursday for us.
Got it. Thank you.
Well, if there are no other questions, we are at the top of the hour. So just last call for a question. Okay. Bryce, I want to thank you for your contributions, not only today with this group, but to COPA over the past many years. And, you know, a lot of exciting events occurring. This is a fun ride. So, you know, I just encourage the COPA membership to really get engaged. No time like the present to get engaged. And all you need to do is reach out to the, hop on the website, reach out to the COPA team, and we will, we'll let you know what you can do to help. Okay, thanks everyone. Have a great rest of your day.
Thank you very much.